is called to order. Marson, do you have some announcements?
Yes, Mr. Chair. This meeting is being recorded for minute-taking purposes, as well as for posting of the recording of the proceedings on the agency's website. This meeting is also being live streamed on the Access Health CT website. Network, CTN, is also broadcasting this meeting. Thank you, Mr. Chair.
Okay. Marson, I understand there's no public comment.
Yes, Mr. Chair, but before we do that, I would like to call for the attendance to make sure that we have a quorum.
Can you call attendance? Thank you.
Yes, Mr. Chair. Charles Klippel, Chair, is absent. Paul Philpott, Vice Chair.
Here.
Thank you. Grant Ritter.
Here.
DJ Gifford.
Here.
Steven Hernandez.
Here.
Thank you. Matthew Brockman. Thomas McNeil. Dina Berlin.
Here.
Thank you. Andrea Barton Reeves, DSS Commissioner.
Peter Hadler attending on behalf of Commissioner Barton Reeves.
Thank you, Deputy Commissioner Hadler. Kathleen Holt from OHA.
I'm here. Thank you.
Thank you. Claudia Galtieri from OPM.
Here.
Thank you. Alexander Borkowski from SID.
Here. Thank you.
Thank you. Manisha Tutani, DPH Commissioner.
Here.
Thank you. And Caroline Zamberi, designee for Nancy Navarrete, DMS Commissioner.
Here.
Thank you. And yes, Mr. Chair, we don't have any public comments.
Okay, thank you. Would the senior membership team that's present today introduce themselves, please?
Good morning, all. James Michelle, Access Health Connecticut.
Good morning, Gina Walsh, Director of Operations, Access Health CT.
Good morning, Holly Zwick, Director of Finance, Access Health CT.
And good morning, Rebecca McClear, Director of Technical Operations and Analytics, Access Health CT.
Good morning, everyone. Susan Richby, Director of Legal and Governmental Affairs, Access Health CT.
Okay, thank you.
Okay, I'm going to go next. I'm sorry.
Good,
Tammy Hendricks, Tammy Hendricks, Director of Health Equity and Outreach, Access Health CT. My apologies.
John Carbone, Director of Small Group Product Development at Access Health.
Good morning, Glenn Jurgen, Director of Human Resources, Access Health CT.
Marquise Davis, Director of IT, Access Health CT.
Yeah, I'm Ranzone and Consulting Actuary from Wakely.
Good morning, everyone. I'm Karan Rustagi. I'm a Director and Senior Consulting Actuary at Wakely.
I believe, Mr. Chair, that concludes the introductions.
Yeah,
okay, that's great. Are there any comments or questions about the minutes of the previous meeting? If not, the chair will entertain a motion to approve the minutes.
Hi, this is Grant. Motion to approve.
Thank you.
Tom McNeil, second.
Thanks. Marson, would you call the roll?
Mr. Chair, is there any discussion on the motion before us?
No, I asked for it, and I didn't hear any. So.
Okay. So I'll call for the roll. Charles Klippel, Paul Philpott.
Yes.
Grant Ritter.
Yes.
DJ Gifford.
Abstain.
Okay, thank you. Steven Hernandez.
Yes.
Matthew Brockman. Thomas McNeil.
Yes.
Dina Berlin.
Yes.
Thank you. Peter Hadler.
Yes.
Kathleen Holt.
Yes.
And Claudia Galtieri.
Yes.
Thank you.
Okay, motion passes. Thank you. And I'd like to introduce James Michelle, our CEO, for the CEO's report.
Good morning, everyone. Thank you, Paul. I'm James Michelle, the Chief Executive Officer of Access Health Connecticut, and thank you for joining us this morning. Before we get started, I wanted to share that I have been spending a lot of time over the past few weeks with our senators and U.S. representatives to discuss the potential expiration of the enhanced premium tax credits. I have participated in press conferences and meetings with elected officials to talk about the impact on our customers if these tax credits expire at the end of this year. It's important to continue to share this message as Congress debates if and when is the best time to keep healthcare coverage affordable for Connecticut residents. And I also want to mention that we have an internal team that's developing a plan or strategy so that if that does happen, when it happens, we could pivot and execute accordingly. Because there's a lot of communication that's got to be done. We have to update our system and work with our carriers. And so we will continue to develop that strategy. So we hope that it happens sooner rather than later. But when it does happen, we will be ready with a plan to execute and to minimize the disruption this may cause our customers in Connecticut. And we will keep the board up to date with any news that may impact Access Health Connecticut and its customers. About 2 weeks ago, actually last Wednesday, October 8th, we hosted our community conference. I want to take a moment to highlight what happened during that conference. Again, the community conference, we bring together over 240 of our partners, including brokers, certified application counselors, and community organizations from across the state. We were honored to have Congressman Joe Courtney join us, along with representatives from DSS, the Office of Healthcare Advocate, and both carrier partners. This conference is important. It allows us to bring all of our partners together to prepare for the upcoming open enrollment, aligning our goals, sharing updates, and working together to better serve Connecticut residents. The work we do in the communities doesn't happen alone. It takes collaboration across sectors, from state agencies to local organizations, to make health coverage accessible for all Connecticut residents. I want to express my deep thanks and appreciation to Tammy Hendricks and her team and all the Access Health staff who participated to make this conference the success that it was last week. We will be sharing more details on the conference later in the presentation. I also wanted to report that we will be conducting a leaver survey for qualified health plan and Medicaid customers at the end of open enrollment period who did not re-enroll in 2026. The goal is to understand why customers who had health coverage in 2025 are not renewing coverage for plan year 2026. We have done this leaver survey over every year over the last several years, and then we've always reported back to the board. At this point, again, more information will be delivered to the board by Katie Hearns when she gives an update on the open enrollment preparation. Our meeting today will begin with open enrollment update from Katie Hearn, our Associate Director of the Enterprise Project Management Office. Open enrollment, as you all know, begins November 1st, roughly about 2 weeks from now, and unfortunately this year it's going to start on a Saturday, and it ends on January 15th. Katie will discuss technology, marketing, and outreach preparations for this period. She will also provide more details about the leaver survey. I would like to express, again, my thanks and appreciation to the entire team at Access Health, especially the senior leadership team, for all the work we all did in preparing for this open enrollment period, especially during these unstable and uncertain times in the health insurance space. After that, Ren Zong, who introduced herself earlier, of Weekly Consulting, and Susan Richby, Director of Legal and Government Affairs, will provide us with a recap of this year's consumer impact study. They will forecast the impact of the rate increase on individual health plans. Then John Carbone will give a quick update on Business Plus. This is our equal platform, and we will close. Hopefully, we have enough time. With Marquise Davis, Director of Information and Technology, will report on our 10 clicks or less project. And again, our platform that we are developing to make it easier for Connecticut residents to apply for health coverage through Access Health. Mr. Chair, I'll report for questions now.
There any questions for Charles? All right. Well, with that, can we have Catherine give us the open enrollment report, please?
Thank you, Mr. Chair. Good morning, everyone. I'm Katie Hearn, Associate Director of the Enterprise Project Management Office, and I have some open enrollment readiness updates for you today covering technology, marketing, and health equity and outreach. As James mentioned, our open enrollment period is the same. It's November 1st through January 15th, and we're continuing to prepare for addressing changes due to HR 1, the One Big Beautiful Bill Act, as well as the Marketplace Integrity and Affordability Final Rule. The system release this year that we had to prepare for OE was successfully deployed on October the 10th. The system included the expected end of enhanced subsidies for qualified health plan households at the end of the year. And our system is now equipped to handle other federal changes when necessary, including those related to the stay issued as a result of a challenge to the final rule filed by the City of Columbus in the Federal District Court of Maryland. I wanted to mention also that in the event that the enhanced subsidies are extended, we're in the process of creating a plan to work with our partners to prepare for that. Next, please. This slide lists the scheduled dates for our projection and auto renewal notices for qualified health plans and individual dental plans. Access Health's pre-OE window shopping period is on track for the last week of October. And this year we have a new Pay Now feature. This allows customers who self-serve to link to the carrier's websites through the Access Health CT website to make their initial premium payments for the 2026 plan year. And I don't have it on the slide, but I also wanted to mention we have a new carrier this year for dental. We have Guardian Dental joining us for open enrollment. They'll be offering individual dental plans for the first time through Access Health this year. Next, please. Next, please. Sorry. Okay, this is the direct-to-consumer pre-OE communications campaign. As you can see, we've been communicating with our customers since August. Letters were sent to everyone fitting the market segment noted by the asterisks there. And at this point, most of the letters are out with the exception of the last one, which is the projection letter. That's one of the most important letters because that letter tells customers what they are currently enrolled in and how much it costs, as well as how much that plan would cost them next year. Those will be in hand between October 20th and 25th. They will have received letters in advance letting them know to expect cost increases and why. But this is the time they will get their personalized estimates when they receive their projection letters. The calls to action are to shop around for a plan and to seek a broker for free help. Some letters also include a link to the federal changes landing page on our website, which explains the changes in more detail. And the next page has some examples of the mailings. Next, please. This is the postcard. This was the first pre-open enrollment mailing. It highlights that changes are coming with a summary of the changes and states that free help is available. It is available in English or Spanish. Next, please. And this is the more detailed letter outlining the federal changes. It includes information about how to find a broker and also how to find our health equity and outreach team at enrollment events for free in-person help. Next, please. Thank you. Here we have some future deadlines for marketing communications. The first is focused on letting current customers know what deadlines are coming if they have not renewed their plans. And the second segment we'll reach out to during OE will be those who are enrolled in a plan without cost sharing reductions if we believe they may be eligible. So we will let them know we think they may want to shop for a silver level plan with cost sharing reductions if we think they may be eligible. And we'll also reach out to consumers that we believe may be eligible for the Covered Connecticut program. Thank you. Okay, on the next slide, we'll take a look at a summary of our open enrollment ad campaign. This is our paid advertising campaign. We use our zip code targeting to ensure we're spending most of our budget on communities with higher rates of uninsured, and those also happen to be our most underserved communities. There are several statewide efforts that ensure media placements to reach as many Connecticut residents as possible. And here are a few of new opportunities this year that we wanted to highlight. First will be on Tubi, which is a free streaming app. It has a high adoption rate in Connecticut. It has an ad feature that allows ads to display when content is paused. So we'll be running Access Health Connecticut ads for the first time this year on Tubi. We also have a new agreement with Fox 61 to have weekly segments so we can highlight upcoming deadlines and specific news topics for more in-depth coverage than our 30-second or 15-second TV ads. The Hartford Current website will feature a countdown clock during the month of December to highlight the time left to enroll in a plan for a January 1st effective date. We have some media influencers this year via WFSB and WVIT Telemundo. These well-known journalists will feature posts about open enrollment on their social media pages. And we have some new in-person activations. One is the Hoop Hall College Basketball Series at Mohegan Sun. There's signage on site for the duration of the event. We also will have some other in-person events this year, including one at Parkville Market. We will feature signage at Parkville Market that draws folks from all over the state. And we will have a scavenger hunt there also to raise awareness about open enrollment. Another activity is National Cupcake Day. We'll have branded Access Health cupcakes on December 15th, which is also a critical enrollment deadline for us. And that's a fun way to sort of engage and also get good social media traction. And rounding out our OE campaign, you'll see cable and streaming TV, terrestrial and streaming radio, a variety of online ads, including paid social media, as well as plenty of out-of-home placements, including billboards, signage at transit stations, pharmacies, grocery stores, and more. Next, please. Here we have what is known in the marketing world as sample creative. The main message is that we're here to help you enroll in health and dental coverage, and we're offering free help. Some of the longer form ads will mention that some financial help may no longer be available, but not all financial help is going away, and that's the critical message. Additionally, many of our ads can be changed quickly if Congress extends the enhanced subsidies, and marketing is in the process of recording a version of voiceovers in case that happens for TV and radio ads. Next, please. The next slide shows all the resources and activities offered by our health equity and outreach team this year. There are 4 newly hired trained mobile enrollment specialists who provide in-person enrollment support to customers. And the addition of the mobile enrollment team was achieved within our existing budget. We reallocated funds previously used for temporary staffing. We have 23 enrollment fairs planned across the state, especially in areas with the greatest need. And we've expanded our Navigator program this year to include 6 Navigator organizations. Health Equity and Outreach continues to offer virtual monthly healthy chats to the public and virtual monthly community partner meetings to help external stakeholders stay informed. Access Health and its community partners, as James mentioned, had a very successful annual conference this year in Old Saybrook. And I have some more information on that on the next slide. As mentioned, there were 240 attendees from across the state. Opening remarks were made by Congressman Joe Courtney. We also had 2 honorees this year, Vice President and Chief Programs Officer Maria Matos of Latinos for Educational Advocacy and Diversity, or LEAD, as well as licensed psychologist Dr. Richard Stilson. A large group session was offered discussing the federal changes and coverage impacts, and there were also 6 breakout sessions on topics such as the new Business Plus platform, Medicaid renewals and redeterminations, and funding realities and opportunities for community organizations. And before moving on to the Leaver survey, I just wanted to credit the entire senior leadership team as well as all of the departments that have been working very hard to prepare for open enrollment this year. Next, please. Customers who do not renew coverage through Access Health will be given a short survey to identify the factors contributing to their not renewing their qualified health plans or Husky Health programs. We will select a vendor to help develop and administer the survey in November, and we will share our survey findings by April of 26. The survey will allow us to consider the barriers to renewing and the respondents' current health insurance statuses. It will be available in English and Spanish, and we will use the data to inform outreach and retention strategies. Thank you.
Any comments or questions for Katie? If not, Katie, thank you very much, and we'll look forward to the survey results next April.
Thank you.
Now we'll have the consumer impact study, and I'll turn this over to Susan Richby. Susan.
Thank you very much. So as you may remember at the meeting last month, after the insurance department presented their information on the approved rates, I mentioned that we would be following up at this meeting with a consumer impact study. So we always do this so that we can give you information on what those rates actually translate to for Access Health CT consumers. So I'd like to introduce Ren Zhang and Karan Rostagi from Wakely Consulting, who will be presenting the consumer impact analysis for you for 2026. Thank you.
Yeah, good morning, everyone. Yeah, this is Ren. I'm going to be representing the policy year 2026 rate review and consumer impact analysis. Now, this report provides an overview of plan offerings and current enrollment, followed by a detailed look at the rate analysis and consumer impact analysis. Yeah, next slide. We reviewed the rate filings from Anthem, CBI, and CICI, analyzed the rate changes, summarized how premiums vary before and after federal subsidies. Next slide, please. Yeah, for the sake of time, I'll move through the slides fairly quickly, but please feel free to stop me if you have any questions. So there are a total of 22 unexchanged plans available in individual market, 11 from Anthem, 7 from CBI, and 4 from CICI. Anthem also offers 7 off-exchange plans, while CBI and CICI do not offer any off-exchange individual market. Next slide. This slide shows more details on exchange plan offerings broken down by metal tier and by issuer. Platinum tier plans are not available. Next slide. Yeah, this slide is just to confirm that the filed actuarial ranges are within the permissible AV ranges. Next slide. Yeah, now let's turn to small group market. Anthem offers 6 on-exchange plans and 20 off-exchange plans. CBI and CICI do not participate in small group market. Next one. Yeah, moving on to current enrollment. As of September 2025, there are about 157,000 members enrolled in individual on-exchange plans. Anthem has around 88,000 members, and CBI has about 65,000. CICI has roughly 3,600. With a 56% market share, Anthem has become the largest on-exchange individual carrier this year, surpassing CBI, which was the top carrier last year. Next slide. These 2 tables show how enrollment has shifted over the years. The first table breaks down enrollment by metal tier. We can see that the gold plan enrollment declined in 2025, reversing the growth we saw in prior years. The silver enrollment continued to rise and the bronze continues to decline. The second table shows the percentage of members enrolled in lowest cost plan within each metal tier. Here we see that the enrollment in the lowest cost silver plan continued to trend downward because of the enhanced subsidies made silver plans more affordable. Next slide, please. Yeah, now we dive into rate analysis section. This part focuses on rate changes before federal subsidies. Next slide. Yeah, the overall rate increase is about 17% for individual on exchange, ranging from 1% to 26%, depending on issuer, rating area, and plan. Anthem's average increase around 14%, while CBI and CICI average increase about 21%. Next slide, please. All members who renew to the same plan or the mapped plan in 2026 will see a rate increase before subsidies. This pie chart illustrates the enrollment distribution by rate increase ranges. The percentages in the pie chart represent the share of total enrollment, with the rate increase categories listed on the left. So as shown here, about 30% of enrollees are expected to experience a rate increase of more than 20%. Next slide. Yeah, now we are looking at the rate changes by issuer and the metal level. And silver plans show the largest increases. Next slide. And the following slides show the rate increase by individual plans. For the sake of time, we'll just move on to small group market, please. Yeah, Anthem offers both on and off exchange plans in small group market, with overall increase of average 11.2%, ranging from 5.1% to 14.5%. Average the current enrollment includes 46,816 members on exchange and 1,850 off exchange. And this slide shows the rate increase and enrollment distribution by metal tier for small group on exchange plans. Next slide. And similarly, this is similar information for off exchange small group. Now let's dive into consumer impact analysis. And this section focuses on rate changes after federal premium subsidies. Next slide. And I'll just move to next slide then, please. Can we do next slide? Yeah, let's just dive into the premium subsidies. For a starter, just a quick refresher on how premium subsidies work. The premium subsidy is advanced payment of premium tax credit, also known as APTC. The APTC amount is based on household income and the cost of the second lowest silver. Next slide, please. The key drivers of the rate change after subsidies are change in second lowest silver plan and its premium, and change in plan premium relative to second lowest silver, change in income and household size, updates to federal poverty level, and IRS guidelines on maximum contribution as a percentage of income. Next slide, please. Here is an illustration of how the final consumer premium after subsidy is calculated. We start with calculating the APTC. There are two main components in this calculation, the benchmark premium and the required member contribution. In this example, the benchmark premium is $500, which include $480 for essential health benefits. We call it the EHB, which are the services that all ACA compliant plans must cover, and $20 for non-EHB benefits such as adult dental, vision, and some supplemental benefits. The required contribution is determined by the household's income and maximum contribution percentage set by the IRS. In our example, that amount is $100. So the APTC equals to the EHB portion of the benchmark premium minus the required contribution. In this case, is $380. So the APTC can be applied towards any plan available on the exchange. So for example, if it's used to purchase a plan A, which costs $300 per month, and $290 of that amount is for essential health benefits, the subsidy will cover the entire EHB portion of the premium. However, the member is still responsible for the $10 non-EHB portion of the premium. So the final total premium for the enrollee is $10. Similarly, if the member chooses Plan B, which costs the $700 per month, including $680 essential health benefits, so the subsidy of $380 is applied to the EHB portion, and the member is still responsible for the $20 non-EHB, so the total monthly cost for this member will be $320. Next slide, please. So this table shows the maximum contribution as a percentage of income set by IRS of 2025 and 2026. The 2026 maximum contribution percentage reflect the expiration of the enhanced APTC provisions. The enrollees across the income spectrum, enrollees across the income spectrum can expect increases in premium payments before subsidy. And enrollees with increase above 400% poverty level will subject to large increases in premium payments due to loss of subsidy. Next slide, please. Here is the current enrollment percentage by FPL. We noticed that there are over 90% of members are eligible for APTC in 2025. Among those eligible members, 20% are over 400 FPL. Next slide. The benchmark plan remains the same in 2025 as 2025, with a premium increase of 25.6% in all counties. And this table is showing overall weighted average premium increase after subsidy based on the single household member by age and income. So for example, for a 40-year-old with a 200% FPL, it will see a 129% increase of premium after subsidy. So this is an average premium increase, and actual changes vary significantly by plan and by county. So we noticed that larger percentage rate increase for younger and lower income enrollees. And also, as I highlighted on the very right column, enrollees over 400% FPL will experience higher rate increases, especially among older members. Okay, next slide. The last table illustrates the average impact of single households by age and income. Now, household characteristics such as family size, ages of family members are critical factors that influence the impact of rate increases. To highlight these differences, we have 3 examples that show the impact varies across different household compositions. So in this example 1, we want to illustrate that the subsidies help lower income households, but plan premiums may still increase more than subsidy. And younger households experience small absolute increases, although the percentage impact can still be significant. So in example 1, we say Tim is a 28-year-old with 200% FPL and lives in Fairfield County. So here is a comparison of the subsidies he receives in 25 and 26. So benchmark plan cost $631 in 2025 and $817 in 2026. The required contribution increases from $50 per month to $172 a month. So at the end, the APTC Tim receives increases from $581 to $644 in 2026. Next slide, please. Yeah, we assume Tim enrolled in the lowest cost silver plan in 2025, so he could get the cost sharing reduction at 87% of actuarial value. And Tim's premium goes up by $45 after subsidy if he renews to the same plan in 2026. So the same plan also happened to be the lowest silver plan in 26. So the considerations include if he can switch to a lowest bronze or lowest gold plan, but doing so, he would lose the cost sharing reduction benefits. So if he switches to a $0 lowest bronze plan, his out-of-pocket expenses would increase from $42 to $74. So at the end, although the lower premium would show, the lower average expected cost would increase because he lose the cost sharing reduction benefits. So at the end, the final decision is still based on the total cost of care, which is indicating the lowest bronze will have a lower total cost of care, but be aware that the average out-of-pocket PMPM doesn't reflect the specific individual's health needs. So at the end, it depends on the expected utilization. Tim still need to base the decision on his personal health conditions. Okay, let's move on to next slide. In example 2, we want to illustrate that the households with income above 400% FPL will face larger premium increases due to both loss of subsidies and the rising plan premiums. And older members with a higher income may experience substantial increase in premiums. So similarly, we use a couple, Tom and Karen, both age 50 years old and with income 410 FPL, lives in Fairfield County. So in 2025, they have $1,481 subsidy, but in 2026, they are no longer eligible. Yeah, next slide, please. So Tom and Karen enrolled in the lowest cost silver in 2025, but they will see the substantial increase in their premium in 2026 from $542 to $2,415 in 26. Yeah, similarly, if they consider the total cost of care, the lowest bronze still seem to be the better option. But again, the final decision still based on their personal health conditions and expected service use. So next slide, please. So in example 3, we want to illustrate that county level pricing drives differences in subsidies and premium increases across locations. And FPL thresholds increase by household size. So larger households with the same income as the smaller household may receive more subsidies. So we use a family of 4, John and Jane, both age 45 and have 2 children, age 18, and with income of 450 FPL, live in Hartford County. So in their case, they have subsidy of $1,345 in 25, but no longer eligible in 2026. Next slide, please. So similarly, due to higher premium and loss of APTC, their premium will increase by $1,813 if they renew to the same plan. That's a 204% increase. And to consider the total cost of care at the last row of the table, yeah, the lowest bronze seem to be the better option. But again, similarly, the final decision still depending on the family's health conditions and expected usage. So now we've covered consumer impact from premiums. Yeah, we'll conclude this report with another critical piece, that's member out-of-pocket cost sharing, which reflect the actual financial burden on households beyond just their plan premiums. This table shows the distribution of the member cost sharing by metal tier with percentile, averages, and maximum. Yeah, we can see that 10% or more enrollees at each metal level have no out-of-pocket costs, and the most enrollees do not reach the maximum out-of-pocket amount. So that concludes this presentation. Together, these findings give us a picture of how upcoming rate and subsidy changes, as well as total cost of care, would affect consumers across different households. And thank you for your time.
And if I could just
Okay.
add, oh, sorry, Paul, if I could just
Go
add.
ahead. I'm sorry.
Sorry, this is the shorter version in the interest of time for the board presentation. There is also a much longer version that Wakely also prepared. And so Martin will be sending that around to the board members after the meeting as well. So that gives you even more information on different examples and different levels. Thank you.
Thanks, Susan. Well, I'll certainly look forward to getting that additional information. Right off the top, a 17% rate increase on top of what are really some very high absolute rates, and then reduced subsidies or people not qualifying for subsidies. Also, we have people enrolled that don't get a subsidy at all. So, I mean, right off the top, I'm concerned you may get some disenrollment because of these higher rates. I mean, am I crazy?
No, Paul. We anticipate a reduction in enrollment numbers for this year, and it'll continue to go down over the next 9 to 10 years. But right now, our strategy, Paul, is I think Katie mentioned that we're gonna really very aggressively encourage all of our customers currently to work with a broker and talk with them and find something that's affordable for them and their families. Remember, all the plans in the exchange all cover the essential health benefits. So at a minimum, they would have that. Even if they get a bronze plan, that's more affordable. But the basic coverage will be included in all the plans. It may not be as rich as what they have in 2025, but they will have coverage and it will be affordable for them. But they have to work with a broker that's going to assess their personal or family situations and help them find a plan and on the exchange that will fit their needs. And also, again, needs in terms of health as well as affordability. So that's going to be the drive. Again, we know who those folks are. We know, and so we're going to target them with I think Katie indicated, the emails, the texts, and the targeted by zip code outreach we're going to do will be based on those folks, specifically those folks we think that are high risk of not renewing simply because the premium is going to go up so high.
Right. Well, thank goodness for the brokers, because one of the points that I was going to also bring up is that when you're talking about these benefit changes, some of them are counterintuitive. So certainly these folks are going to need some support while they're, looking at these various alternatives. So we're relying on the brokers, obviously, but for the people that don't have brokers, I'm hearing, James, that we will support those people. Is that correct? Absolutely.
Again, that's why we increased the outreach team. We added four new employees in the outreach team. So, and there would be in-person support in the communities. That's in need of the greatest help. But those communities, we and historically, we have to be there in person, and they are the population within our system that's most likely not to have a broker.
Right. Well,
Right now, go ahead, Paul. I'm sorry.
I don't want to monopolize the discussion, so why don't I call for questions and comments from my colleagues on the board?
And
I
Dr.
think Dr.
Gifford has a
Gifford has
question.
a question.
Grant,
Thank you. Thank you.
Dr. Gifford.
And Paul,
go
I
ahead,
agree.
please.
Thank you. I agree the numbers are jarring. I appreciate the presentation from Wakely. It's really helpful to see these examples made, concrete. I'm wondering, James and Susan, what our strategy is for getting this information to our Connecticut legislative body, and what, if anything, we are working on with them to address some of these challenges now that we know with some certainty what we're facing.
So, Dr. Gifford, we have been communicating with the governor's office, state legislatures, chairs since July. We've been projecting using 2025 rates. Since we've gotten 2026 rates, we've updated our information, but we've been communicating this with the real estate and insurance committee, the entire committee, and we presented to them. We've met with the governor's office. We met with the leadership at the House and the Senate. So this has been ongoing since July. So everybody is fully aware the impact this is going to have. And we've used similar examples. How dramatic the impact would be to Connecticut residents. So everyone's fully engaged, fully aware, and they express same concern that both you and Paul have expressed. So the communication that you asked about, that's been going on since June or July, continuously.
And do we know, James, if there is an intention to do anything? Or is there a proposal or a strategy to backfill some of this that's, in writing?
Yeah, so I don't know about in writing, but we have been providing information to elected officials and impact this will have in certain segments. The entire population of our customer base, but we broken it down by certain segments, and certain segments are impacted more dramatic than others. So I know there's some conversation going on behind the scene among the elected officials in the governor's office, see what they could do to support that. We've provided estimated costs by segment to the governor's office and the state officials as well. We know there's a conversation going on, but I'm not sure where it's at this point.
Thank you.
Any other comments?
Dr. Gifford, they have all the information. They have detailed information, who, when, where, and how. So there's a lot of work, a lot of conversation going on behind the scene about this and how to address this. But it's going to be very expensive. But they have all the data that they need at this point.
Okay. Well, my concern is that we've reached some kind of a tipping point here, and that's because we've got the intersection of the loss of the enhanced subsidies, a high and ever increasing absolute rate of the insurance policies or coverage. And I mean, that delta is just going to keep going up, I would presume. And I think particularly for people that get a small or no subsidy, I think we're going to be increasing the uninsured population in that segment. So anyway, I'll look forward to getting the additional information that you're sending out from the report. And James, maybe we could put this on, have a further discussion of this at a future board meeting.
Yes. Certainly, hopefully at the next board meeting, we'll have more certainty about the enhanced subsidies.
Right.
I think we have
Okay.
we have a question, Paul.
Okay, go ahead, please.
Ms. Holt.
Thank you. This question has to do with the collection of information, and I know you have a fabulous team that does a great job looking at all of the different data. This has to do with the idea that the sicker people will remain in the plans because they have to, and the people that we will see leaving because they can't afford it or they've made other choices are going to be the more healthy people, right? So the population will grow within the cost data part of it. So I guess my question really has to do with whether or not Access Health has access through the insurers of the claims data so that we can track the increasing number of dollars that are being spent per enrollee that are not now being, that are, as they are now being kind of spread out over the entire population of both sick people and healthier people, which is just the typical insurance risk pool. So can you speak to the data collection on the claims piece, please?
Sure. Well, we don't have access to any of the claims data. We don't have that. So I think there are the insurance department may have some access because they have to look at claims history with respect to reviewing rates before they approve them. And I think that Dr. Gifford, maybe you could talk about that. I know your former agency is working on looking at de-identified claims information to try to look at population health and look at some type of patterns.
Yeah. So James, I think your point's well taken about potential adverse selection. I mean, I think it's well documented that when insurance rates go up and people disenroll, the sickest one stays and the healthiest ones go. I mean, that's pretty well. I think most of us that have been in the business understand that. I do think, however, that the subsidies do change that a little bit, so that if you're receiving a high subsidy and you're healthy or sick, either way, you're probably going to stay. So I think it does ameliorate things a bit, but I mean, this is not a pretty picture. So again, I mean, with the concurrence of my colleagues on the board, I mean, I'd like to have some more discussion about this at future board meetings.
We'll make a note of that and do that. But Kathleen, they all pay a claims database. That doesn't reside with Access Health. So we have zero access to it.
All right. Well, Susan and Wakely, thank you, or the CID, thank you for the presentation. And if there are no other comments, let's move to the strategic initiatives presentation.
So I know a lot of folks leave at 10 o'clock, so we're going to try to get through this in 2 minutes each to my colleagues, because we still have to vote. Make sure you have a quorum to vote to end this meeting. So John, can you do your presentation in 2 minutes, if you don't mind? And then again, we can come back and give more in-depth update at future meetings. John?
No problem. Good morning, everybody. John Carbone, Director of Small Group Product Development and Broker Support. I want to take a few minutes today to share where we are with Business Plus. Over the past few months, we've been building a strong foundation to make healthcare easier, more flexible, and more affordable for small businesses. The momentum is growing. We're getting more leads, more quotes, and more interests every week, and our focus now is turning that interest into real membership growth for 1/1/2026. We've trained over 450 brokers, continuing to help them understand how Business Plus and ICHRA can work and how our team can step up and support them. Our team is responding faster to them and making sure our employers and employees have help and they get all the service and technology service they need. On the technology side, our quoting and enrollment tool is live and improving every week. We're piloting a carrier portal and testing new features that make the experience smoother for brokers and employers, and making sure that we get the word out and continuing to do multiple trainings for our not-for-profits, our small businesses, and our broker community. Recently, we traveled to Maryland and met with their state exchange and their leadership team to share ideas regarding ICHRA and Business Plus platform and how our platform can align with their goals in the future. And we had a great productive meeting with them. They're extremely interested in replicating our product. We also know that this is a big change for the Connecticut small business market. Adapting a new model like ICHRA takes time and trust, and that's important for us to keep moving forward and educating the community, our brokers, our non-for-profits, and our business leaders. Looking ahead, our priority is to keep it very simple, continue to engage with our brokers, continue to engage with our employers and communities and our non-for-profits, associations, chambers, and quote every case that comes through the door, showing options for the individual market, ICHRA, and small business. Business Plus is more than a product. It's a new way for small businesses to look at health insurance, and our team is laying that foundation. Thank you for all your energy, effort, and your belief in what we're building. James?
Thank you. Maryland is has a very strong interest at leveraging our platform for their state's small businesses. So we are in discussions with them to see where that goes. So we'll keep the board informed as to how that's progressing forward. Hey, Marquise.
John, have we had any enrollments through ICHRA yet? Do we have any employers? We have?
Yeah, yes, ma'am. We have right now for our 2025 OE, we have about 13 groups that have enrolled, little over 66 members. We have over 450 quotes staged for our 2026. The enrollment is, the effective date is for a 1/1, so most of them do not want to do that renewal twice, so they're kind of holding off until the OE rates come out to see what's going on also with subsidies. Only want to do it one time, don't want to do it twice in a very 3 to 4 month period.
Well, that's good. We've got started anyways.
Yes, ma'am.
Good job.
Thank you.
Yeah.
All righty. Good morning, everyone. I'm Marquise Davis, Director of IT for Access Health CT. Today, I'd like to give an update on 10 Clicks, which is our modernization effort for our enrollment and eligibility system. This update will highlight how we mobilize the organization through cross-functional teams aligned by business and operational areas in our ongoing collaboration with DSS. One of the most impactful decisions that we made earlier on in this process was to activate members of our staff to become subject matter experts as project champions within their own respective areas. These champions are not only helping shape the scope of work and functional requirements, but they're also serving as peer advocates and liaisons, ensuring that we're not just designing something for the organization, but with the people who know the system best for the residents of Connecticut. This approach is helping us mitigate blind spots, generate buy-in, and prepare internal teams for what's to come next, especially in the areas of operations where workflow will be transformed dramatically. Recognizing the scale of this transformation, we built a deliberate and phased change management process. Staff across the organization will know what's changing, why it's changing, and how they're going to be supported throughout. Our collaboration with DSS continues to be a critical part of this project development. Our early on collaboration with DSS helps ensure that our systems work well together, eligibility decisions are coordinated, and we stay aligned on future funding and reporting requirements. Their input has helped us shape a solution that meets both operational and regulatory goals and ensuring alignment with Medicaid and other DSS initiatives down the road. Next slide. We officially posted the RFP on September 23rd. We're currently in the vendor Q&A phase. responding to questions ahead of the formal evaluation process. And here's what the next several months are going to look like. Proposal submissions are going to be due October 31st. Evaluation phase runs through October 31st through February 20th of 2026. Vendor selection and contracting will be finalized April 30th of 2026. We'll begin implementation in the first week of May of 2026, and our target go live is going to be June 1st of 2027. This is a major undertaking. I'm proud to say that we're both on schedule and aligned internally. By enabling our staff and project champions, actively managing change, and strengthening our partnership with DSS, we're setting the stage not just for a successful launch, but for a long-term sustainable and meaningful transformation. Happy to answer any questions that you guys may have. Thank you.
Thank you. James, I think we're quickly reaching the time that we need to adjourn.
Yes, we are.
So why don't we, before we lose a quorum, why don't we go ahead and entertain a motion to adjourn? Do you agree?
Absolutely. Yes.
Okay. Thank you. We certainly have gotten a lot of information today that can generate some future discussion. So I'm looking forward to that. With that, the board will entertain a motion to adjourn.
Yeah, hi, this is Grant. Motion to adjourn.
Thanks.
Second, Deidre Gifford.
Thank you, Deidre. Discussion? There being no discussion, Marcin, will you call the roll, please?
Yes, Mr. Chair. Charles Kleppel, Paul Philpott,
Yes.
Ron Grader,
Yes.
Deidre Gifford,
Yes.
Steven Hernandez, Matthew Brockman, Thomas McNeil.
Yes.
Thank you. Dina Berlin,
Yes.
Peter Hadler, Kathleen Holt,
Yes.
and Cody Gualtieri. Thank you.
Okay, resolution passes and the meeting is adjourned. Thank you.
Thank you all very much.